It's time for us to take our health segment this morning, and we have a very important discussion to have. We're taking a look at the link between drug and substance abuse and mental illness. Now, we're talking with Dr. Maimouna Kadiri, popularly referred to as the celebrity shrink. Now, she's a multiple award-winning health physician and advocate, as well as coach, and it's an honor to have you on the couch. Welcome back.
Thank you.
So, mental health and illicit drugs.
Yeah.
I've often wondered, because I've heard different conversations where people say if they smoke a certain substance, it gets them to a lot more open-minded. They think better. They apparently work better in some certain situations. I've also had some people say that when they take some certain drugs, it calms them down. So what is the link between these substances and mental illness?
Good question. And yes, quite a number of people do that. Why? Because people with social anxiety, as maybe a public speaker or a performer, and they can't get on stage and see that crowd. Sometimes they kind of take alcohol. Alcohol will calm you down, calm your nerves and all that. Somebody with depression who is trying to get out of that bad mood or that low mood and low energy, loss of interest in things ordinarily they love to do, some of them indulge in marijuana. It's not just which can, of course, get them excited, and some of them even become productive and they do a lot of things. It's not even about the use, it's the excessive use and abuse. And it's that excessive use and abuse that we are looking at. Because when you look at the global statistics, about 275 million people use drugs, and about 36 million of them, or 30 million of them, are having one form of the order of drug abuse. But let's bring it back home, because when you talk about global, it looks as if it's too far. In Nigeria, the current statistics says that about 14.3 million Nigerians are abusing drugs, and out of that, between the ages of 15 to 65. And about 3 million of that are having one form of drug abuse or the other. This is where it gets us, because we are women. 1 in 4 Nigerian drug user is a woman. Women are natural nurturers. So you can imagine we being messed up. How do we groom the next generation? And the highest use of substance in the country is cannabis, because it's accessible, affordable, available. So in 2030, we are estimating that about 20 million Nigerians will be abusing drugs. So we must nip it on board right now, that link, because when people continue to abuse substances, they can easily lead to mental illness, because mental illnesses affect the way you think, the way you feel, the way you behave. And substances, when they are used or abused excessively, they can affect the way the person thinks. Their mental health and their nervous system. Now, you touched on something. You said social anxiety. Now, this is a disorder. Yes. You also said, so there are many different depression, which is also a disorder. Yes. Now, there are many young people who are on stage, entertainers, in front of cameras. There are many people who are in states where they have to become public speakers. But it's not just those people. Just getting through the day. Just getting through the day, This then makes me lean on the fact that there's a larger percentage of people with mental disorders than we think, and who are sort of self-medicating with these drugs. Exactly, different. And so you find out that who are those that are likely, when you look at the link, it's what we call bidirectional. People, so we need to know that not everybody that has a mental illness will abuse drugs, and not everybody who is abusing drugs will have a mental illness. Yeah, because we have people abusing drugs, they don't have mental illness. But we need to know, why are people, what is that link? People that are having mental illness are in denial. They may just be every other thing that comes to play, take this, take that, and before you know what's happening, they're abusing one substance or the other. People that are having mental illness, but they are, hiding it. So anything under the weather, any illicit drug, whatever, that will just get them to that stage there. Then you have people that are already having existing mental illness, like the depression I talked about, self-medicate. As far as you are self-medicating, there's a thin line. And this is where a lot of us need to be very careful.
Okay.
We are not sleeping well.
Okay.
And then you just believe that, okay, if I take this pill to enhance my sleep, I will sleep better. Drug addiction is not an event. Most times it's a process. So we find out that quite a number of us that are not sleeping well, we go to the doctor, they will give us medication, but we won't go back for a refill or to reevaluate. We'll just take that prescription and keep buying and keep buying. Okay. And most of those medication, which we call benzodiazepines, where Valium and Lexotan fall in, before you know what's happening, one tablet you're using in the first and second week, by the third week you're using 2 tablets, by the second month you're using 3 tablets. That is where tolerance, dependency, and addiction sets in. So you're having sleep issues, go resolve it with your doctor, not take drug enhancers. So
now I want to touch on the word itself, mental illness. Yeah. To be mentally ill to the average, the average layman, they expect it to make reference to someone who's on the street, who is unkempt, who hasn't combed their hair or looks dirty or the like, or who shows erratic behavior. That's not the type of mental illness you're talking about. At all. So you're not saying that smoking certain substances or taking certain substances would lead to someone going on the street.
Let me tell you the truth about that man on the street. Okay. 2 things are about that man or woman on the street. Either the relatives don't know where they are, or they know they don't want to associate with the person because of stigma and discrimination. Okay. Now, this is the big news Nigerians need to listen to. That man on the street or that woman, that person is just 1% of people that live with mental illness. 1%. 99% is everybody here on this studio. Package madness. Are we not looking glam? We are packaged. Yeah. So the truth is, I don't know who has taken an antidepressant this morning to come here. You don't know who has taken marijuana, heroin, whatever, to calm his nerves, and he's sitting down here pretty productive, doing what he or she is supposed to do, and it's not disturbing anybody. So we have to be very careful. That stigma and discrimination is what is not encouraging help-seeking behavior. Okay. Is what is not encouraging people to speak up and speak out. Is what is not encouraging people to get help from the right people, the right places, and the right time.
So the truth is, whenever they say we should go to the dentist, they say we should go twice a year.
Yeah.
Whenever they say go to your optometrist, they say once in 2 years, I think.
Yeah.
Go and check your eyes, go and check your teeth. How many times a year do you believe the average person should visit a mental specialist?
At least once. When you do your medicals, also ask to do your mentals. Because the truth is that we are all stressed. The main reason why you even see a doctor or you go to a pharmacy or go to your religious leader is the word stress. And that is over 90% of the cases. So why don't you just check your stress level, know what is affecting you so that you can nip it in the bud? Because prevention is still always better than cure.
Definitely. So for those who have possibly been to a doctor and they've been diagnosed with some certain mental disorder, and they're in that denial stage you talked about earlier on, what advice do you have for them? And for the parents who are watching the young people indiscriminately use certain substances or have suspicions about it, what advice do you have for them?
But if you're already dealing with a mental illness, or you've been told you are dealing with a mental illness, being in denial will only make it prolong and the outcome worse. So it's better to accept it just the way hypertension, diabetes, cancer. The only difference is that we are sympathetic towards these people, but we stigmatize people living with mental illness. The earlier you accept and embrace it, the better. Mental illnesses are treatable, beatable, and manageable. And for the parent out there, if you even have an intuition that your child is abusing substance, run with it. Make sure you nip it in the bud. Your child stop opening the door when you knock and whatever. Your child always takes your key and say they want to go and wash car and whatever. These are some of the things that will show you that there's a problem. Run with it. Don't be in denial. And please, please, parents, listen to your child non-judgmentally so that you can understand what the problem is, not necessarily listening to respond to them.
Thank you so much, Dr. Maimuna, for coming to talk to us. And I have a feeling a few people learned a few things today. Please reach out to us with our hashtag WakeUpNigeria on TVC, at TVC Connect, with your questions and contributions. We can't wait.